Yeah, it's weird. Hey, everybody. I'm so excited. We are going to try something new today. I am working with Hoosier Action. I got Will Staffer at a coffee shop across the street from the Indiana Statehouse, and the Care Not Cuffs chapter of Hoosier Action is going to be I'm having problems with Facebook. I don't know why. That's weird. Um anyway, I am going live. I'm going to interview Will. We're going to interview other people with the Care Not Cuffs chapter of Hoosier Action. And we're going to be live streaming the press conference that they're having there, kind of demanding better for all Hoosiers, because I don't know if you've been paying attention to Project Next, but we could be doing better. So here is Will Staffer. Will,
Yep.
how are you, my
Stopper.
friend?
Yep.
Stoffer. Sorry, I said your name
Yep.
wrong. Stoffer. All right.
Hey,
So tell
everybody.
us what's going on today.
Yeah. So I've got some people here with me from New Albany. So if you guys want to get on and share a little bit of your story, we're on a Facebook Live here. But yeah, we got people coming up from all corners of the state to the State House today to demand action from our legislators on issues related to harm reduction. So it's a harm reduction day at the State House. As we know, many people in Indiana, many Hoosiers, I don't know any Hoosier who isn't impacted by the overdose crisis. And we know that recovery works, that harm reduction works. We know those are the evidence-based things. And we know that incarceration really doesn't. And we need a compassionate approach. So we're here today with a bunch of people from all across the state to demand our state legislature actually acts for us around harm reduction.
And this problem is
Yeah.
getting worse, right? More people are suffering from addiction. And yeah, throwing them in jail is not fixing the problem. We need better action. You have the research on what works. So why don't we do that? Why don't we do some things that work?
Yeah, well, I think the main thing, and I think everyone will tell you in the Care Not Cuffs chapter, that there's just a lot of shame and stigma around for people who use drugs, former people who use drugs, right? Just general poverty things, right? People who don't have homes or houses. There's just a lot of stigma around those things, and that stigma really prevents people from our lawmakers from actually understanding the issues. And honestly, most lawmakers don't hear from regular people about what's actually happening or what the struggles are. They listen to big corporations, they listen to corporate lobbyists, they listen to the apartment association, but they don't listen from everyday people. And that's why we're really here today, to actually make sure people's voices are heard. They get to share their stories and their perspective and talk to the legislature about what they want.
You're exactly right. That's what makes Hoosier Action so amazing. You bring people that have had this problem, where if government were better, their lives would be better, and you bring them to the legislators that are passing the laws that really don't know much about the problem because maybe they haven't had it. And you say, here's a real human being, and if you made this law better, it would help people like them. And we're missing that right now in our government.
Yes. So I gotta go talk to someone real quick. I'm gonna pass the phone to Eddie.
Okay, good. And then I've got two people on I can bring on too. Let me bring them on.
Okay, cool. Yep. I'm gonna pass the phone to Eddie here. I'm gonna hold this. Yep.
Hi. How are you?
Good. Okay.
My name's Eddie.
You're waiting for the press conference. I'm gonna bring somebody else on. I'm gonna mute. Hang on. I'll bring somebody else on. Oh, here. Okay. I'm gonna mute you. And then who's this? Hi.
Me?
Yes. What's your name?
My name's Eddie.
Eddie. Hi. And why are you here today?
All right, so I'm from New Albany, Indiana. So what happened was when I was younger, I lost my family and my wife in 2011 in a house fire.
I'm so sorry.
I decided to go out and use drugs because the man that lived down the street from me, he touched my wife and kids the wrong way and killed them. He burnt the house down. So I went out and did drugs. So I'll be 38 July 6th of this year. I've been sober 3 years on April 1st. This is my third time getting sober. If I would have been sober the first time, I'd have had 10 years in. Second time, 6 years, then I relapsed. So altogether, the last 16 years of my life, I got 3 years sober.
I'm proud of you. I'm so sorry about your family. I mean, this is the story we need to hear. I understand why you wanted to escape your reality. You know,
yes.
I have empathy for it. It's not like you're a bad person. You were suffering something humans shouldn't have to go through.
Well, see, I grew up with my dad beating on me all the time, and he would sell me to females for money and drugs.
Oh,
my mom passed away when I was 9 months old. My stepmom, she used to beat on me. So I learned to grow up to be a man when I was younger, when I was like 11, instead of being a kid. And then on top of it, since I quit doing drugs, I started having seizures. I have to take medicine for that. I have to learn to say no, ma'am, yes, ma'am, or yes, sir, no, sir, to people I don't like people like who are here right now because they're trying to shut everything down. And to me, I started from the bottom and I trudged from being in the dirt, from being outside, being in a tent, to going to jail, getting out of jail, going to rehab, learning how to take care of myself. Learned that when I got out of rehab, that people said, "Oh, we're about to shut this down." I'm like, "Well, no, we need the money for rehab because why do you want to send people to prison that does drugs? I can see if you want to send people to prison that touch kids or people to kill somebody, I can see that. But why would you want to send somebody that does drugs because they lost their family member? Why you want to send them to prison to level 4?
It makes more sense to get you care, get you in recovery,
Yes, then
see
it
if
is
you
to
can
send me to
handle it, give
yeah.
you the tools needed to go back in society. And once you're arrested, it's so much harder to get a job and to get into society, right? To be a
Yeah,
good
and
community
what's crazy
member.
about it is you get caught with say 6 ounces of weed or meth. They try to give you a felony and they try to give you 25 to life. They send you to prison behind Wabash where you're behind these people that's got life for killing people. And next thing you know, you get put in there and they stab you and you're dead because you get in that cell and they freak out and they're like, "Who are you?"
I've been talking to Tony Hostetler, and we're going to try to get some people on that want to talk about what it's like in prison, because we just don't want to think about it. We want to just not realize
Yeah.
how terrible it is in there for
Well,
people.
see,
And then yeah.
I got sent to Indianapolis, so they sent me to Next, where you lock down for 23 hours a day. You're out 1 hour, you get your dinner, you take a shower. Well, my old roommate that I was with, I didn't know he touched kids. Okay, so I got locked up when he was a color man. He comes out and the foyer we're eating. They stab him 27 times, kill him. The white dude looks over at me and says, "You're next. You're next if you keep hanging out with somebody like that." I said,
I'm
"Damn."
just
I said, "I
glad
didn't
you're
know that."
alive, my friend. I'm glad you are
I
alive.
looked at him and said, "I didn't know that what he did wrong. All I know is they put me in a cell with him, and I spent 6 months there. Then I got
Wow.
off the bracelet. They sent me back. I'm on probation for a couple years. I walked that off. Next thing you know, last 3 years of my life, it's been a miracle. I'm here.
I'm really glad you're here. I'm going to pull up Josh, and I will get back to this camera phone in a little bit. Thanks for being on. And oh, I'm so glad
Thank
you're
you.
alive. Will, should I get the other people now for the press
Uh,
conference? I've got Josh and
sure.
Mary on too.
Yeah, Mary, do you want to talk now? All right, Mary will be
All
up. Yep.
right. Hey, Mary, how are you?
I'm good. So
Nice to
I've
meet
been in
you.
recovery for 5 years, and I spent about 11 years in and out of the justice system with no offering of treatment. That was never a solution for me, or was never on the forefront of my mind. Not that I would even know if I was willing to do that at that time, but it definitely was never an option that
So
was
you were
offered.
arrested for addiction,
I
never
was
given
arrested.
any recovery help. And how long were
No.
you in prison, in jail?
So 2012, I was in my late 20s. My story's a little different. I wasn't always in active addiction. An event happened, no coping skills, crime ensued due to addiction. And then I got stuck in the justice system and kept catching charges as a result of not having the tools and resources to even know how to stay sober or even get mental health treatment, right?
So you're
So
someone that if proper care was given to you at the beginning, a lot of these awful things would have not happened.
I believe so.
Right,
I believe that
right.
if I knew it was an option and there was tools and resources that I knew about, my life may have looked different. But I am in grad school. I'm 5 years in recovery. I'm a mental health counselor in practice. So I got an undergrad degree. So anybody can recover. Anything is possible. That doesn't have to be the end of your story. Your story can be whatever you want it to be if you're just willing to do some work. And there are so many great places that are out there that really do help you achieve success, not only in recovery, but in life. So if you're willing to just kind of take a look at us as people, we're not a case number. We are not a DOC number. We are human beings. We are someone's daughters, sons, sisters, parents, and at the end of the day, how much is a life really worth? Are you going to allocate some funding for us to get better, or are we going to keep allocating funding for the cleanup of the causes of addictions? you
Yeah,
know.
let's start it at the beginning. Let's help you at the
Yeah.
beginning so that you can get out of the community. Way to go for being in your getting this program and being a therapist. That's amazing. And you're gonna have so much life experience to help people. That's
Most
I'm really
definitely.
proud of you.
Thank you.
I'm very proud of you. I'm gonna pull up Josh.
Real quick, we got one more people here,
Oh,
one more
okay.
person
Sorry,
here.
sorry,
So
Josh. I'll give
yeah.
you a second. Okay,
All
yes.
right.
What's
You
your
would say
name?
your name and
Hi, my name is Patricia Sumner, and I am homeless at this time.
Oh,
I've been
I'm so
waiting two and a
sorry.
half years for my Section 8 voucher, but there's not enough homeless places that I can go to. So right now I just stay at the White Flag, which is a homeless coalition, and I'm just waiting for stability through housing, and that's it. Thank you.
I hope that happens for you.
Thank you.
Yes, yes. Thanks, Will. And then who are we seeing on these pictures? Are these pictures of people that have passed away due to addiction?
yes,
Oh,
yes. Those are people that we have lost. Yes. Yep.
I'm so sorry. It is
And
such a
yeah,
problem. I'm so
yes. And
sorry.
Patricia works in recovery.
And I work in recovery too. I am a sponsor.
You're helping people and you're homeless.
Yeah, I'm a
I'm
sponsor at this time. Yes.
yes. Well, thank you for doing that. And I'm so sorry that you are unhoused right now. And I hope your situation gets better.
Thank you very much.
You're so brave. I mean, what bravery to be in this situation. You think she'd be poor me. No, she's fighting to make things better. She's fighting for people she cares about. It's incredible. And
Oh yeah.
this is not what I think our elected officials that are passing laws to hurt them. This is not the reality of what they
Right.
see. They need to
Right.
meet her and tell her to her face that they're
Oh
cutting
yes.
more
No.
programs.
100%. Yeah. And that's why we're here, right? We've got to do that. Like, people have to be treated as humans. Right. Yeah. It's crazy to me when people dehumanize other people, and uh, yeah, don't actually take people seriously. And our lawmakers need to actually listen to what people's concerns are. So yeah, yeah, and the
All
housing,
humans
yeah,
deserve,
and we really do have way
basic.
too long of a wait list in our region down there, right? You know that, you've talked to people. There's just too many people that are waiting for Section 8 housing or waiting for public housing, and we don't have a homeless shelter. We don't have things we need, from local to state to federal. Right? We need changes at all levels, and so we're here at the Statehouse because they've got some really bad bills up right now that are trying to criminalize homelessness. And yeah, they need to hear from real people about how that's going to impact them. So we need investments, not incarceration, not punishment. That's
Right.
what people need. So yeah.
Should I pull up Josh now? Is the press conference about ready to start? What should we do?
Yeah, let me see where he's at. We're getting a little bit closer to starting here, and I'll probably hand my camera to Carrie to hold up with the
Okay,
front
I'm gonna
facing
put
shot
Josh on.
once
I
we
keep
once we
putting him
get
on and
there.
taking him off.
Yeah,
Josh,
I'll go on
sorry.
mute. Yeah.
Hi,
Sorry, I keep putting you on and taking you off. How are you?
I'm good. How are you?
Good. So why are you here today? Why did you ride that bus and drive up 2 hours from New Albany to be out in the cold outside the State House?
Well, I'm from Terre Haute, Indiana, and I myself struggled with addiction for a long time, and I just recently celebrated a year being clean and sober off methamphetamine,
Congratulations.
and my life is awesome today. I get to be a part of things today, and I just want to experience this once in a lifetime. Maybe come back for more.
I'm so proud of you. And so why is the reason you're here? You're a year sober, but you're taking your day out to do this. What drives you to do this?
I just want to tell you that it can be done. Recovery can be done, and it's amazing. You know,
So
I
you want
got
to stop the stigma? This
I
is
do,
possible.
and I'm gonna face this around if I can. And
Sure, you can try. It worked for Will when he tried it.
all these people right here, I have a huge army behind me, and it's amazing. My life is good today. I don't have to think about using, drinking, drugging, and my life is amazing today with these people in the background.
Is the press conference starting now?
It's about to start. Yeah. Hey, so you want
Okay,
to go on? Yeah. Yep, Sarah. I'm going to go out there. It's about to start soon here. So
great. Okay.
can you? Yeah, we're going to go a little closer so
Thank
you
you,
can get the shot
Josh.
and hear. Can you hear?
All
Okay.
right. I can
But yeah,
I
it's going to
cannot
start in
hear
just a minute, Sarah.
I can't hear Tony.
Welcome, everybody.
Now I can. Okay.
My name is Tony Hostetler. I am an addict in long-term recovery. I'm also the lead organizer of Carry Not Cuffs. chapter of Hoosier Action. We are a nonpartisan, secular organization. Anyone is welcome, regardless of faith or whatever party you represent. You're welcome at our table. We want to welcome everybody to our second annual Harm Reduction Day. What an honor to be standing with all of you on the steps of our State House, to be joined with so many from all over the state. We're here today not only to lift up our lost loved ones in recovery, in memory, but also to hold our elected officials accountable to why we continue to lose so many to the disease of addiction and complications of being unsheltered. The loss of one more life is one too many. We're going to run through the agenda real quick. We're going to start off with our memorial service. Jake is going to lead us in a little opening secular prayer. We're going to have Sean is going to come up and open up our memorial service. We're going to hold up some pictures of some of the lost loved ones. And then we're going to have a read off the names of people we've listed that we want to memorialize. Then we're going to have a brief moment of silence. Then we'll get into our press conference and talk about some of the bills that's been proposed this year, what's moving on the floor. Then we'll hear from 3 different speakers about harm reduction and being homeless and some of the hurdles that we run into. Jake, would you offer up a prayer?
Absolutely. Just join me in prayer. As we are gathered as one community today, we invite and welcome the Spirit of life to bring grace, peace, and joy to our time together. At a time when human suffering is all around us, and when it seems like answers are few and far between, this gathering of people gives life and hope. We are grateful for this community, for the breath filling our lungs, the sun shining on our faces, and the wind in our hair. Let's take a moment to sit together in this moment and let this spirit of gratitude wash over us. May our time together inspire others to seek grace, peace, and joy in the world around them, and to see the spirit of life in everyone. May it be so.
Good afternoon, or good morning. My name is Shauna, and I am co-chair of Care Not Cuffs chapter for Hoosier Action. We are not gathered here for politics today. We are not gathered here for statistics. We are here for people, for sons and daughters, for mothers and fathers, for best friends, for the empty chairs at dinner tables across our state. Addiction does not make someone disposable. Addiction does not cancel out their humanity. Any addiction does not mean they were loved any less. The opioid crisis did not begin because someone woke up and said, I think I'd like to ruin my life this year. No one chooses to become dependent. No one chooses to devastate the people who love them. Addiction does not start with a desire to self-destruct. It starts with pain, with injury, with trauma, with prescriptions handed out freely and without warning. Addiction is not a character flaw. It is a health condition, and we should treat it like one. And we need to stop pretending that punishment is prevention. If incarceration worked, we would not be building larger jails. If incarceration worked, we would not be standing here at another memorial. This disease does not check your GPA. It does not check your bank account. It does not check your zip code or the color of your skin. It is no respecter of persons. It is ravaging our communities, quietly in some neighborhoods, loudly in others, but everywhere. These are not those people. These are our people.
Right.
Our brothers, our sisters, our mothers and fathers, our sons and daughters. These are our lives. And I stand here today not speaking about recovery as a theory, but as a lived reality. I've seen what happens when we lead with punishment, and I have lived what happens when we lead with treatment. There is a bedroom in this state that will never be slept in again. There is a phone that will never light up with their name. There is a mother or father who still has their voicemail saved because they cannot bear to hear their voice disappear. That is what we are talking about. Not statistics, not headlines, not political talking points. People who were loved fiercely. People who laughed loudly. People who mattered. And here is the truth. The urgent truth. They cannot recover if they're dead.
We're going to hear from Dennis in just a second. I didn't script this part, but Shauna brought something up that we're never going to see some people's phones light up again. And as I was going through my phone this week to send out invitations to this event, I just realized how many people are still in my contacts that aren't here anymore. And I just can't bring myself to delete them because I feel like I'm deleting them out of my life. I still have text messages, voicemails, because I still want them to know that I love them and care for them. That's why we're here today. Dennis, if you would.
Good morning. My name is Dennis Jones. I'm from Owensville, Indiana. I stand here today to speak my daughter's name. Her life mattered. Her name still matters. Her name is Sarah Louise Jones. To fully share Sarah's story, I need to share a part of her mother's story as well. Sarah's mother, Donna, lived with cerebral palsy and was prescribed narcotic pain medication for many years. When Sarah later required surgery for a mass that was resting on her heart, she too was prescribed those same medications. What began as pain management quietly became dependency. At the time, I did not understand addiction. By the time I did, it had already taken hold. As Sarah entered adulthood, she was introduced to heroin. There were overdoses. Narcan saved her life more than once, though I didn't even know what Narcan was at the time. Then Sarah became pregnant and found herself in a Chin's case. What felt like devastation became the turning point. Sarah fought. She got clean. With the help of programs like Sunrise Recovery, she did the work. She regained full custody of her son. She surrendered her life to Jesus Christ. She rebuilt. She was clean for over a year. She was hopeful. She was a mother again. Then another trial hit. Her mother was arrested due to her own addictions. I told Sarah to call me if she ever felt the urge to relapse. Well, on July 23rd, 2021, I received a call no parent should ever receive. My daughter had relapsed and overdosed in Evansville, Indiana. The first thing I did was check my phone to see if I had a missed call. Nope. But she texted me. Dad, can I move in with you? I'm in a big fight with my boyfriend. It is too much. Why didn't you call him? The next 5 days was the longest days of my life. She never did recover. Toxicology showed it did not take much, just a small amount of fentanyl mixed in with benzodiazepine, similar to Xanax. Sarah never meant to take fentanyl. She thought she was taking something to calm her emotions. Instead, she was poisoned, and she died. On July 28, 2021, I lost my daughter. She was 28 years old. Then just 18 months later, her mother also passed away after years of struggling with addiction. Through these tragedies, I made a decision. Today, I am a registered Narcan distributor through Overdose Lifeline. I help provide life-saving harm reduction supplies so that other families get a second chance. This is about prevention. This is about compassion. This is about saving lives. And I do it to honor the lives I've lost. Thank you.
Thank you, brother. We're going to take just a few moments and read the names of those we want to remember. Not just remember the faces and names, but all of these faces and names are sons and daughters with family and friends who love and miss them. They no longer get to experience the gift of recovery.
We have Dallas Dean, Jackie Freeze, Charlie, Amanda, Joe, Tanya Proctor, Chris Heiser, Aubrey Gibson, Lisa Gibson, Thomas Ball, Timothy Smith, Steve Castro, Lauren Gurley, Antonio Tutt, John Buckman, Dalton Tyndall, Geikus Jones, Julius Darby, Pamela Tyndall, TK Bryant, Gabrielle Castro.
I've got it. It's really light.
All right. Haley Snyder, Kelsey Slaughter, Casey Ashby, Joe Williams, Danielle Moreland, Sarah Goldie, Max Plastic, Jeff Skaggs, Brian, Josh Pierce, Storm, Affiliate, Braden Wolf, Desiree March, Sarah Jones, and Cody Stanley.
Thank you all for that. It really means a lot. Can we now get just a moment of silence to further honor their memory? Again, thank you for joining me in honoring our lost loved ones. We're going to shift gears a little bit now. We had some critical bills move through session this week. Bills that are only going to further hinder our friends from getting better. Yes, we got an extension on the syringe service program, but for 5 years instead of 10. Data shows that SSPs return over 100% of needles that are turned in. Now clients will be limited to the same amount of clean syringes that they turned in. This will lead to our friends having to reuse a dirty needle, in turn leading to more soft tissue and bacterial infections. They will now have to show ID to utilize services. It's hard enough to walk in the door of a health department or distribution center to use these services without feeling judged or stigmatized. Now they're going to have their name and Social Security on file. This is far from an optimal bridge to recovery. But it's about more than harm reduction tools, these syringe service programs. It's about the connections they get to walk into a door and talk to a peer support specialist or somebody that's been down that road. And they build that relationship with somebody to help ease that bridge into recovery. They're voting on this today. I'm going to speak on it. I didn't rewrite it, but they're voting on the criminalization of homeless people at 1:30. We're going to break off here in a little bit. We're going to go talk to some senators. We're going to try to sway that vote. But it's very possible it's going to be a crime to be unhoused or unsheltered in the state of Indiana. This shows a complete lack of empathy. for people already in a tough situation. It's downright sinful. Our small rural counties deal with these issues as well as larger cities and towns, but we don't have alternative resources. That leaves little to no options other than citations or possibly arrest. We've tried for 50 years to arrest the drug epidemic away. It doesn't work. Period. Now we're going to try and arrest people simply down on their luck. Talk about kicking somebody when they're down. We're going to hear now from our speakers who've had bouts with substance use disorder and being down on their luck.
Substance use, particularly opioids, is not a modern crisis. It has existed since the beginning of humanity, with references reaching back as far as biblical times. Across generations, substances have been used for pain, survival, ritual, and escape. What has changed is not the existence of addiction, but how society chooses to respond to it. Too often, substance use disorder is framed as a moral failure instead of what it truly is, a complex disease shaped by biology, trauma, environment, and access or denial of care. Addiction does not follow one path. Some individuals develop substance use disorders through experimentation. Others turn to substances to self-medicate untreated pain, mental health conditions, or deep trauma. And then there are those who are introduced to drugs long before they ever had a choice, by the very people meant to protect them. I am one of those people. Hello, my name is Tracy Skaggs. I am a licensed social worker and the founder of Project Recovery Southern Indiana. But today, I stand before you as a person in long-term recovery from opioid use disorder. My introduction to substance use came through my own parents, with the use beginning at the age of 4. Addiction was not something I chose. It was something I was born into, normalized around me, and passed down through generations. This reality is far more common than we want to admit, yet rarely spoken out loud. That generational cycle followed me into adulthood. My husband, Jeff, struggled with substance use disorder. He was not defined by his addiction. He was a father, a partner, and a deeply loved human being. Yet stigma, shame, and barriers to care ultimately contributed to his death and from an overdose. His life was not lost because help didn't exist. It was lost because access is not equitable and compassion came with conditions. Today, I am also the parent of a child with an opioid use disorder. This time, the outcome was different. My child is alive and in recovery because harm reduction resources were available. Resources that reduced risk, prevented death, and kept them alive long enough to choose treatment, healing, and stability. That distinction matters. Survival came first. Recovery followed. Amen. And the generation cycle has finally been broken. This is the truth we must stop avoiding. People cannot recover if they do not survive. Criminalization does not prevent homelessness or addiction. Stigma does not save lives. Punitive policies deepen harm, reinforce generational trauma, and increase death. Harm reduction is not controversial. It is proven. It is evidence-based public health. It is compassion backed by data, and the difference between life and death for families like mine. And yet, policies about addiction and homelessness are still often written without including the people most impacted. Decisions are being made in rooms where lived experience is absent. Laws are shaped by fear instead of facts, ideology instead of evidence. When people who use substances, people in recovery, and families who have buried their loved ones are excluded, the result is not safety, it is harm. Right. Policies created without us do not protect us. They punish us. They cost lives. If we want policies that actually work, we must include the voices of those who live these realities every day. We must listen to lived experience, not dismiss it. We must treat addiction as a health issue, not a moral failing, and stop legislating from a distance while people are dying up close. Because when policies are written without people most impacted, The harm is not theoretical, it is fatal. Thank you.
There you go. This stuff.
I really feel.
Very good.
That's how I feel.
That's right.
My husband is dead because of policies that exist.
Right. So many.
Good morning. My name is Missy. I'm a member of Hoosier Action's Care Not Cup, and I am in recovery. But before I was in recovery, I was a little girl. I grew up with two parents who were addicted to drugs. By the time I was 8 years old, I was actively using drugs with my parents and my sister. At 8 years old, I did not know what addiction was. I did not know about brain chemistry or trauma or cycles. I just knew that this was normal. At 14 years old, my doctor started prescribing me Vicodin and diet pills. By 16, I had dropped out of school so I could stay home and get high. And the scariest part, I didn't even think I was an addict. In 2013, my dad passed away. My mom and sister became addicted to heroin. I became addicted to spice and I became homeless. In 2018, my sister died from a heroin overdose. 6 months later, my mom died too. Addiction did not just impact my family, it buried them. For 3 years, I slept on abandoned house porches. I slept wherever I could, and I want to say something about homelessness that people do not understand. Homelessness is not freedom of will. It is constant survival.
Yes.
It is wondering where you're going to sleep, if someone is going to hurt you, if your belongings will still be there when you wake up, trying to get a job without an ID, without clean clothes, without a place to shower, without a phone to receive calls back. Your things get stolen, you lose documents, you move constantly. The system does not feel designed to lift you up. It feels designed to keep you there. And now we are talking about jailing people for being homeless. Jail will not fix homeless. Jail will not fix addiction. Jail will not fix mental illness. What it will do is add a criminal record, another barrier to employment, housing, and stability. It creates more locked doors for someone already standing outside. I lost custody of my children because of addiction. Eventually, I lost my parental rights. Do you know how much shame that I carry? Do you know? I would get clean and then I would relapse. I was terrified to ask for help. I felt myself slipping, not because I did not want help, but because I was scared of how people would look at me. I was scared of the stigma. I was scared of being judged instead of supported. Harm reduction saved my life. It was not enabling me. It was keeping me alive long enough for one more conversation, one more chance, one more opportunity to choose recovery. We have seen what happens when we ignore harm reduction. HIV breakouts, preventable death, families destroyed. Prevention works, access works, compassion works, but jail does not. You cannot incarcerate someone into stability. You cannot shame someone into sobriety. You cannot criminalize someone into housing. These are human beings. Many of them are someone's child, someone's parents, someone's whole world. I know because I was them. And today I stand here employed, accountable, in recovery, advocating not because I was locked up, but because I was given access to support and to resources. Please do not create more barriers for people already fighting to survive. Our lawmakers must pass bills for harm reduction and help. They need help. They need treatment. They need resources, and they need access. Thank you.
Better help somebody.
Help somebody.
Help somebody.
Hello, I'm going to start with a quote that I've seen on a billboard coming into downtown Indy. In the crossroads of America, where it all comes back around, where you are, where you were, they say, you come from where you are going, and I am not that far away. Hi, I'm Megan Cawthorn, and I'm standing here today because of where I came from. I was raised by addiction. I will start off with sharing my professional experience, but just know that that's not the reason why I'm here today. It's my personal lived experience, and the losses that I've endured is what I'm using my voice for today. I currently work within Indiana's treatment systems, collaborating with providers across the state to increase access care for individuals navigating substance use, disorder, and recovery. But I didn't enter this field by accident. In 2014, I helped my father try to find treatment at a time where access was limited, wait lists were long, insurance barriers were real, medication-assisted treatment was heavily still stigmatized, harm reduction strategies were controversial instead of understood. I saw firsthand how difficult it was to navigate a system that should have been designed to help. That experience is what led me into this work. But my understanding of addiction started long before my professional career. When I was 17 years old, I woke up at my boyfriend's house thinking he was sleeping peacefully beside me. He was snoring pretty loudly. I remember not wanting to disturb him, so I gently kissed his forehead, slipped out of his bedroom, and made my way to school. Throughout the day, I would send texts, send calls, anxiously await for the lack of response all throughout the school day. What I thought was just snoring from a dead sleep was actually one of the most common and overlooked signs of overdose.
Amen.
The unresponsiveness was another sign I didn't know to look for. And after several ignored texts and calls, I began to panically call his family members, demanding to know where he was at. Of course, in a 17-year-old mind, is he cheating? What is he doing? Why is he not calling me back? Never would I had imagined that he was at Methodist Hospital due to an overdose. I had dealt with addiction my entire life, but no one warned me about the lethal consequences. While I was going to school, trying to steal my future, he was sealing his fate. That sound, that gurgling sound, is something you expect to hear from someone at the age of 85, not 17. But I didn't know the signs. I didn't know what overdose looked like. And that is why harm reduction matters. Harm reduction is more than just providing medication to reduce cravings and supplying a safer replacement. It is more than just clean needles implemented in response to a public health crisis like the hepatitis C and HIV outbreak that called for these strategies in the first place and have been proven effective. Harm reduction is also education. It is teaching families what an overdose looks like. It is equipping communities with tools like the naloxone. It's reducing stigma so someone seeks help sooner rather than later. It is creating a bridge to treatment and long-term recovery. Had I known, had I had the tools, I immediately would have administered Narcan that morning, called 911, and began seeking out treatment. He was only 17. This is just one example of a life that could have been saved through harm reduction. Whether we are implementing these policies to protect our youth, every age, race, social class, all deserves the same life-saving effort. And you, legislators, hold the pen. My father was on prescription medication for most of his adult life. He worked multiple jobs, and he raised 4 children on his own. He did the best that he could with the cards he was dealt. When access to his prescription medication stopped, he sought relief in something more lethal. In less than a year, I watched my father, my hero, go from a functioning parent to needing immediate intervention, and I, as the older daughter, was the one who ran to his rescue. He fought hard for 2 years. I stood beside my father in a treatment rehabilitation program as he began to build his life back at the age of 45. But the grips of addiction is powerful, especially when systems and policies are fragmented and support is inconsistent.
Right.
My father lost his life to heroin after using one more time. It was 10 years ago this past month. And the wake still follows. It leaves a ripple. Ripples in children, ripples in families, ripples in communities. Those ripples transfer pain, create generational trauma, and leave the entire communities carrying the weight of that loss. But today, I stand before you as my father's wake.
Yes.
Right.
But instead of letting those ripples pull me under, I chose to step into this fight and battle addiction head on. I began working on the front lines with the boots on the ground, walking alongside day by day with individuals, helping them navigate through the trenches of early recovery. I have sat next to families at funeral homes after overdoses. I have sought solutions and resources for people navigating housing instability, insurance barriers, system-involved processes, and jumping through the endless hoops just to access treatment that should be their right.
Right. Yeah.
I have identified gaps and created solutions and efforts to address those gaps.
Yes.
Through co-founding my own nonprofit, Recover Out Loud, where I boldly proclaimed that I will use my voice and speak loudly about my experience in hopes that it transform the communities that once silenced us.
Yes. Yes.
I learned to stand so bold to be a voice that can help reduce stigma, connect people to resources, and build recovery capital for individuals who have once been written off.
Yes.
I have witnessed the power of a changed life that can start with a warm handshake, a hug that welcomes them through the front doors of recovery and treatment instead of being met with a closed, cold metal cell.
Yes.
And today I serve in the role of community relations for Indiana Treatment Centers, where we are built by people of Indiana for the people of Indiana, focusing on elevating community efforts that increase treatment access and removing barriers at a systems level, building partnerships and improving pathways to recovery and helping the individuals access care before the crisis escalates.
Amen.
From peer support to systems coordination, I've seen addiction from every angle. But what remains true at every level is this: we cannot arrest addiction. It is a medical condition that lives in the brain that requires treatment and sustainable support that strategies like harm reduction can offer and have offered several others. Hoosiers deserve solutions that preserve families. They deserve education that prevents tragedy. They deserve access to care without unnecessary barriers. They deserve policies that keep their loved ones alive long enough to choose recovery. I am here today because my father isn't. And I'm asking you to do your part to help ensure that fewer daughters will have to make that dreaded phone call and protect mothers from having to outlive their children. Thank you.
Thank you.
Thank you. That was powerful.
Thank y'all. You know, people in recovery and some of our unhoused people, we're just built different. We tell each other we love each other because we do. We give hugs. But we also do that because we know there's a chance we may not see them alive again.
Right.
We suffer from a fatal but treatable disease. When someone is diagnosed with cancer, heart disease, kidney disease, their best prognosis is to get back to as healthy as they were before the disease. People in recovery, we get better the longer we're in recovery. We treat our disease. We go on to become peer support specialists, social workers, licensed clinicians. We We get to stand on the steps of our state house and use our voices in unison to again hold our lawmakers accountable for further trying to oppress us. How many votes is one human life worth? A society that normalizes apathy slowly forgets what it means to be a human being.
Come on.
We're going to continue to use our voices. We're here today. We were here last year. We'll be here again next year. We're not going away. We're only going to grow stronger.
That's right.
We, Care Not Cuffs, is going to spend this year visiting with outreach and care groups, getting our people, felons, people with substance use disorder, people that are food insecure, people that are living on the street, and we're going to register them to vote.
Right.
And we're going to educate them on why it's important to vote, especially in state and local elections. Building an army of those that were once overlooked in society.
Coming for you.
This is also the 250th anniversary of our great nation. So we're going to celebrate by creating our very own Bill of Rights.
That's right.
Right.
Claiming our stake in Indiana.
That's right. I'll stay.
We have a say.
We do have a say.
We have rights.
Yes.
And there's things we need to treat our disease.
That's right.
All the outreach groups, I love what they do. It's great work what they're doing, but it's not truly helping. We need help from our lawmakers. Again, a Bill of Rights for those in recovery, for people that are unhoused or unsheltered. Again, those of us normally cast aside from our oppressors. Because I want you at our table. Because when they make decisions about us, for us, we want a seat at their table.
That's right.
Nothing about us without us.
That's right. Nothing about us without us.
Nothing.
Are y'all with me?
Yeah.
Nothing about us without us. Are y'all with me?
Yeah. Nothing about us without us.
Nothing about us without us.
Thank everybody for coming.
I remember getting to live on by other people, and that's the positive I was saying. Beautiful.
Hey, Mary, can you hear me?
Onyhos.
Huh?
All right.
All right.
Will, that was really beautiful.
Yeah.
I'm so
Yeah.
proud of everyone that spoke about their own life. Wow.
Yeah. Yeah. Did you want to talk to anybody, any of the speakers?
Yes, I would love to. If any of them would like
Okay.
to come
Would
on.
you like to, Tracy, would you be able to talk to Sarah Blessing's crew here? It's a little recap. Okay. This is Tracy from Project Recovery.
Hello.
Tracy, thank you so much for sharing your story. I'm so sorry about all the things that you have had happen to you, and I think it's really incredible that you got up there and spoke. When did you first get involved with Hoosier Action?
So I got involved with Hoosier Action probably back in 2020 during the COVID days. That's when I first started.
And why do you do this work? You've already had a lot of rough things. You've already had a rough life. What makes you do this extra stuff for Hoosier Action?
So I do the extra stuff because the people matter. People feel like they don't have a voice. My ultimate goal is not to be the voice for those who feel like they don't have any, but to empower them to use their voice. And until they have that courage, I will stand in the gaps and speak loudly.
Yeah, and yeah, Tracy, Tracy's part of Project Recovery.
Yeah.
So, yeah, so we're just in partnership with her. She's got her own organization.
Oh,
But
okay.
yeah,
So Project
back in the day,
Recovery.
yeah.
Okay.
Me and
is
Tracy and
how can we
Tony.
find that? Is that Project Recovery? Do you have a website? Do you have a Facebook page?
We do. It's Project Recovery Southern Indiana Inc. There's a website, and then we also have a huge presence on Facebook.
That's amazing. Thank you so much for doing that.
Absolutely. Thank you.
Thank you.
All
Yeah,
right.
that's
Thank
great,
you,
Will,
Chris.
that you guys work with other organizations that are doing the
Oh
same
yeah.
work.
Oh yeah.
Yeah.
Tracy's a powerhouse. Yeah. Yeah. She was really instrumental in helping move Narcan in New Albany and getting the city of New Albany. We did a campaign together back in the day, back in 2020.
That's
Or
incredible.
2021, 2020, yeah. So she was really instrumental in that. Okay, let me see if I can find anybody else.
You are literally saving lives. I mean, pushing the Narcan in our community is saving our neighbors' lives, Will. It's,
Yes,
yeah.
yes.
Yeah, the move out of state just to.
Would you like to talk to somebody?
Sure. Yes.
All right. Yes.
Hi,
So,
what's your name?
Hi, Megan.
Hi,
and what
Megan.
order are
And
you with?
what?
Yes, I am with Indiana Treatment Center, but I'm also the co-founder of a recovery community organization, Recover Out Loud, based out of Columbus, Indiana,
Oh,
and
wow.
personal long-term recovery.
That's amazing. And what made you get in
Everybody,
this
we want
work?
to get a photo of everybody, please.
Well, really, it started with the loss of my father in 2014, and just kind of being sick and tired of addiction, corrupting my life, and it was time to stand up against it.
We gotta get a photo, Sarah. We gotta get a
I'll go
photo.
ahead and get off. Thank you so much for doing this, Will. Thank you for taking time. Hopefully I can get you all more attention. Love to
Yes,
all of
yes.
you.
We'll come on again soon. Thank you for covering this. Yes.
Thank
All
you.
right. See ya.
Bye.
Bye.
Thank you guys for watching. I hope this impacted you like it did to me, hearing those stories. It was really beautiful, really sad, heartbreaking. I really liked the line, "We cannot arrest ourselves out of this problem." Throwing these people in jail is not working. It's making things worse. Making homelessness a crime is not going to make things better. It's going to make things worse. It's hurting. It's kicking people when they're down. Um, I'm really thankful to Hoosier Action. I'm thankful to Will. I'm thankful to Tony. I'm thankful to Kate and everybody that works there. Please follow them on their website and their Facebook. There's Mary. Hey, Mary, you guys taking a picture? There's their picture. So cute. And I'll just leave that on while we get off. So please follow Hoosier Action. If you live anywhere in Southern Indiana, you can attend their meetings. They have meetings all over. Sometimes they're like in Columbus, sometimes they're in Bloomington, sometimes they're in New Albany and in Jeff and in Clark. So just follow them on their website. I believe you can get like a newsletter so you know when the events are. You can become a member. If you don't live in Southern Indiana, but you'd like to help them, I believe you can be a member and pay dues to help keep them going. But they're just going to continue to grow, and we're going to keep pushing power to the people. Thank you so much to everybody, and just so much love to those fighting in the recovery space. You can do it. You can do it. Keep it going. And thanks for those that are pushing for better legislation so we can help these people to recover, because you can't save an addict who's overdosed. So let's stop that. Love to all of you. Have a fantastic day. And also, if you want Project Next merch, you can go to the store, heylmer.com/Project Next, and you can follow us and share the show anywhere. Send it to anybody that maybe needs some hope, or maybe that's in their own recovery battle, and just let them know they're not alone. Bye, you guys.